Welcome back, Brittany, to continue on your patient story where we had left off. You were talking about your career and, that your degree and feeling kind of stuck after getting sick, and getting this degree and wanting to jump right into the criminal justice system, which I know we had talked about earlier. I can very much empathize with that. I was in a very similar position myself. And I was like, what the hell is this degree for? Like, it's worthless. It's nothing. And, when you're really sick and you can't do the thing that you envisioned for yourself, that you worked really hard for, it makes you have some trouble at least feeling, worthy at that point. At least I can speak for myself that way, how it seems like you've got a great support system with your husband. So how did that transition look for you once you did have to kind of walk away, hopefully temporarily, from the dream job that you were in to where you are now?
So I took it was probably a couple of months just to kind of try and get myself better. I know at that point too, because I was still losing weight rapidly and the doctor couldn't really stop it.
Hmm.
Um, and I wasn't really eating still anything despite having been on Reglan and unfortunately the few medications they have to kind of use for this disease, I'm actually allergic to most of them. So
Oh no.
yeah. So my GI was like, we're gonna have to figure out something because if we don't, you're gonna end up getting a feeding tube. And that was where I kind of put my foot down because I'm like, I don't want a feeding tube. And I,
Hmm.
and I know that sometimes that's just what has to be done in order to save your life. But at the same time, like, I don't want to be attached to a tube. I just don't.
I get that.
Um, And I think a lot of it was the fact that I have a emetophobia, and I know that that triggers your gag reflex a lot and stuff like that. And usually, my GI is like, the feeding tube, first off, it's not going to be going directly, it's not going to be sticking out of your stomach. It's going to be down your nose. The first one usually, it's what they like to do for a trial. And I was
Yeah.
like, I'm not comfortable with that. I don't want to do that. And I had tried to do some more research on medications, and I came across domperidone,
Hmm.
which I have to credit as a big lifesaver for me because if it wasn't for that medication, I probably would have a feeding tube by now, and
Yeah.
my life would be way worse than what it is. Um, so once I left there, my doctor was like, "Yeah, we can absolutely put you on this medication, give it a try." And unfortunately, domperidone is not FDA approved here in the US, as we all know.
Yep.
Um, and the only pharmacy in the whole United States that actually had the proper authorizations to fill that medication was actually a pharmacy which I lived
Oh,
right down the
wow.
road from there. So, um, luckily, I was able to get that medication there and didn't have to get it through Canada, like a lot of people
Hmm.
do, and took that for quite a long time. And I mean, it helped me tremendously. I was able to eat, and I wasn't able to eat a lot, but it was still more than
It
what
was
I was
something.
intaking.
Yeah.
I did my nausea wasn't as bad,
Wow.
um, and it just seemed like I felt like a whole completely new different person when I was on it. And um in the meantime, as far as a job, I had just kind of taken a couple of months off to try to get myself kind of back to maybe I guess I don't want to say normal, but kind of I guess a new normal for me. And um I was trying to get disability too during that time that I was off, and I couldn't qualify for it because unfortunately we have an invisible disease that nobody can see from the outside.
Yeah.
And they still think that it's feasible to still work or even work from home with this. And I understand some
Yeah.
people have great bosses and that will allow them to, like, what you were telling me,
Hmm.
that you're able to do, but unfortunately in my case it's not like that. And
Yeah.
the things that I've gone through doing working from home with different companies, they don't tolerate stuff like this. So,
Yeah.
um unfortunately I had to go back to work. I did like Instacart and things like that on the days that I felt okay to do it.
Hmm.
Um, and I mean, honestly, there were days that I didn't feel like doing it, but I had to push myself to do it because my husband was the only breadwinner in the house, and we had to have two incomes.
Yeah.
And
It's not easy.
no, it's not. And then I ended up finding a job where I had to work in an office for like 3 months, but then after that I was able to work from home
Mhm.
and work kind of using my degree somewhat. I worked as a skip tracer for a private investigator.
That's cool. I
Um,
know who to call when I need to find somebody. I got it. Okay.
yeah. It would be my job to figure out who the lien holder was, where they were at. We ran background checks on people. I mean, I had to call
That's
family
pretty
members of
cool.
theirs, everything. So, in a way, I kind of got to use my degree a little bit in a sense,
Mhm.
but unfortunately, my husband and I had to end up moving from the Dallas area and moving back towards where I live now because my mom got sick and I had to unfortunately help take care of her. Well, I don't want to say unfortunately, but it
It's
was one of
unfortunate that
those.
she needed it, like, that it
Yes,
came to that. I
yes,
got it.
yes. Um, and since then, I've done different work from home things that never panned out.
Mm.
They don't understand the fact of I had well in the midst of all this too. When my mom got sick, my husband was actually working at a job because he's also in the criminal justice field, and almost 2 hours away from where we lived. So
Oh,
he was had
wow.
to be in training for a little while, and he would be gone a whole week, and then would only come home on the weekends.
Mm.
So he would be gone, and then we figured out we were gonna have to pack up our house and move. So I was working a full-time job and then having to pack the house by
Ugh.
myself. So for about a month, I ate nothing but cream of wheat and toast to try to keep my body somewhat stable. But it, uh, all that was so difficult because it's like I was dealing with everything by myself. And
Yeah. Yeah.
then on the weekends, my husband and I would meet up in the town next to us, and we would basically drive back home because I was having to work full time, pack my house, but also drive from about an hour, hour and a half almost every other day while my mom was in the
Wow.
hospital.
That's a lot.
So yeah, and then I try to work full time from wherever I was at. Luckily, my job then was I could work from wherever, pretty
Mhm.
much. But then it became harder to work from, like, if I had to stay at the hospital with my mom, I couldn't work from there because of the privacy things that you have to go into and people's finances and things like that.
Sure.
Like, you couldn't discuss that around anybody else.
Sure.
And so I really couldn't do that. And then my number started slipping, and mentally I was like not okay again
Yeah, it's
because
a
of
lot.
everything. So
It's very
it is.
stressful.
And that's one of the biggest things that I've had to deal with. It's not necessarily the stomach pain and stuff like that itself, it's mentally what this has done to me. I
Yeah.
would have never thought in a million years that I would suffer from, I mean, because I think everybody to a certain extent is depressed. It's just how it
How
kind of
much and how
affects
you deal
you, and
with it.
yeah, exactly, and how you deal with it. So I mean, everybody goes through depression, but I would have never thought in my life that I would have to deal with that as much as I do now. Because it's realizing that, for one, I'm not able to do the job that I wanted to do ever again, and then it's like having to realize that there's so much pressure on my husband to have to work and then have to take care of me, and you feel kind of like a burden
Mhm.
almost in a way. And then
Yeah.
having to deal with, like, I mean, because I have anxiety and depression and emetophobia and panic disorder are just all wrapped up in one, and it's I'm not gonna say that I've acted on it, but I mean there and I still deal with it to this day, but there are times when it's like you feel just like you just want to end it all because
Yeah.
you don't want to live like this anymore, and that's what I wish a lot of people would realize about this is the mental health aspect of it is it's not pretty.
Yeah.
um and there have been times too, and I've said this to my one of the doctors that I've had countless times, and I realize it's probably not the nicest thing for me to think or say, because I've had to deal with my one of my brothers had cancer when we were younger, and I had to kind of see what that did to him, and luckily he's still alive. But I've told the doctor several times I kind of wished in a way that they would have told me that I had cancer rather than something that there's no cure for at all.
Yeah.
Because at least with cancer, you know that there's kind of a game plan, or there's a treatment somehow for it. Or, if it's terminal, then you kind of know
What
the
to
the process
expect.
of I'm gonna die eventually, from this. It's not, yeah,
Yeah.
you got this weird disease that nobody can figure out, or the doctors don't know about, they throw medication at you that doesn't work or causes more problems, and you just have to deal with it every day.
Yeah.
Um,
I think anyone with a chronic illness has felt what you're verbalizing at one point or another,
mhm,
just because the word cancer is more understood than chronic disease or chronic illness, however you want to look at it.
mhm.
Have you ever had someone be like, "Oh, you still have that?" or "Oh, you're still dealing with it?" It's like that's what chronic means. It doesn't go away. Like
Yeah,
good days don't mean it's gone. That's not
I've
how
had
chronic
that.
works.
And then I've also had too, like in my when I lost a lot of weight, some people that have seen me before and then seen me after, losing all the weight, they're like, "Well, what's your diet like?" Well,
What's your
because I
secret?
exactly, I want to be able to lose weight too, and I'm thinking, absolutely not. You don't want to
Yeah.
do that.
Yeah.
And that's what scares me too now a lot about, because I know I'm in a gastroparesis support group. I'm actually in two of them on Facebook, and doctors are pushing like Ozempic and GLP-1s and stuff to people that already have gastroparesis because they have the diabetic form of gastroparesis.
Mhm.
And a lot of people don't realize that these GLP-1s are causing people to get gastroparesis or can make it so much
Yeah.
worse. And I'm like, I don't understand why we're doing this
Yeah.
now.
It's a very hard conversation, and unfortunately, I think there's no right answer for that
Mm-mm.
too, and it's hard. We see a lot of that too. I've seen a lot of it, and when you add the different layers of, GLP-1s and, even just other medications, other chronic diseases that maybe a GLP-1 could treat, it's very, very difficult. And it's a very hard conversation to have and to hear when you are living with gastroparesis and
Mhm.
you've had such a severe, I don't want to say like outcome with it, but you've dealt with it in such a way where you want to keep other people safe by sharing what you've been through. So that way, at least the way that I'm hearing what you're saying is that you want someone to make a decision with their eyes wide open. So at least if
Yes.
they are still making that decision, they know what decision they're making. And, we can only do so much. And that's why I'm like, I like hearing your story. I hate that you've gone through what you've gone through, but that's why we like being able to talk to other patients because your
Mhm.
experience is different than mine and to someone else's. But you sharing this and being so, so vulnerable with us about what you've been through will help somebody else. It'll help somebody else, make a decision, feel less alone, or maybe be more open with their physicians and their loved ones just about what they're feeling because
Yes.
there's other people out there who feel very similarly to you. And, we try so hard to talk about the mental health aspect of this disease, but it can feel embarrassing. It can feel stigmatizing. So for us, it makes it even more important to be honest with each other and ourselves too. So
Yes. I don't feel like there's any. I mean, growing up, I was always kind of taught that in a way, if you've got some sort of something mentally going on like that, you just bottle it up and keep it inside and don't say anything to anybody about it. And
yeah,
I've learned over the years that that's not healthy
no,
to do. And
no,
there's no shame in it. You know, that I have no problem telling people, that, yeah, I'm not, mentally stable sometimes. I mean, I'm only living for other people and not for myself. And that's something I've
yeah.
been trying to work on for a while, is trying to find things in life that make me happy and
Hmm.
not just other people. But I have my highs and my lows, and that's the way it is with I think everybody is. We all have days like that.
Yeah. Yeah.
But yeah.
It shows that we need more mental health support around, chronic illness and just for people who have something going on, that's why we talk about these things and are trying to be more supportive and a little bit more vulnerable and like I said, honest with ourselves too about what we're really feeling. And hopefully the more conversations we have, the more that we'll get that supportive arm and people will see a need for it too, to either become the therapists and the social workers or the psychologists that'll help it for people like us who have maybe an additional level of understanding of chronic illness because if you don't get it till you get it, right? Or maybe you love someone that has something. So if you have that understanding, there's hopefully that's why we keep having these conversations and just really can get more people better care or better supportive care while they're going and waiting for cures, as we
Yes.
all would really like at some point or another, would be
That's
wonderful.
something else that I've had to learn too is you have to be your own advocate. Um,
Absolutely.
because a lot of this gastroparesis stuff is not widely understood by doctors. They don't know
Yeah.
how to treat it or what it is, or, you know, I get told a lot. I know recently when I found out that I was anemic, um, I went to the doctor and I was telling them some of the symptoms I was having where I was tired all the time and had brain fog really bad and then waking up in a sweat all of a sudden in the middle of the night and I couldn't figure out, what was going on. And of course he's like, "Well, you're 35 years old, maybe it's hormones," or you know, he's like, "Honestly," he wrote in his paper, honestly, he said, "I think it's uncontrolled anxiety." And I'm like, I don't think it is, honestly, but they did lab work to prove that it wasn't. And I'm like, that's what I'm telling you is it's not. And the other thing is
Yeah.
too with anxiety and depression and panic disorder, I don't take any medications for that because a lot of those slow down your gut motility
Yep.
and have a slew of side effects that I'm not okay with. And a lot of it is because of my metaphobia. I mean, there are medications that I probably should have taken over the years that I've absolutely like, nope, I'm not because and I understand that side effects don't affect everybody the same way or happen to everybody, but I'm really bad too about as soon as they give me a medication, I'm looking up what other people's reviews is on it because if the majority of
Same.
it is I've thrown up, I'm not going to take that.
Yeah.
I will do everything in my power to not have to. And so there are things that I probably should have taken over the years that I haven't, that I refuse to. And a lot of this medications, even though I've been told several times that I really need to be on something to help, I try to deal with that my own way at the best of my ability. Um, and because I just don't want to have to deal with again with the side effects of it or my gut being any slower than what it is.
Yeah.
So, um, the whole being an advocate for yourself is important because I've noticed in my experience is a lot of doctors or nurses, whatever have you, do like to gaslight people, especially with
Yeah.
chronic illnesses, because you're treated so much differently when you go to, especially going to an emergency room.
Oh
And
yeah.
as you know, being having a chronic illness, you have to go to the ER quite often. For things just like as simple as, getting some extra fluids or something, when you haven't been able to tolerate any yourself. So
Yeah.
you just need that little bit of extra support, and they want to look at you like you're drug seekers, or that you're just paranoid, or just just wanting attention, and like that is not it at all.
Yeah. Yeah, you would think. You would think that that would be the conversation, but unfortunately,
Yeah.
it isn't. Um, I did wanna ask you if you
Mhm.
had hard-hitting question. If you had one piece of advice that you would offer somebody who is newly diagnosed, what would you tell them?
Definitely get on a support group with other people that have the same thing.
Mhm.
Because again, not everybody's journey is going to be the same, but in the end, we're all fighting the same thing.
Yeah.
So There are people out there that you know, if you have random questions, like I've done several times, is or about a medication that I'm scared to take or something like that. I can go online and ask these questions about from other people that are in the same group, and they'll tell you their experiences, or you know, maybe what they've done to try to get over, you know, something or what have you.
Mhm.
So I think the biggest realization is you're not ever alone. I mean, it can
Yeah.
feel like you are because it didn't seem like years ago this was that
Well
widely,
known.
yeah, well known of an issue like it is today.
Mhm.
Um, so because I know, like, when my mom was diagnosed with gastroparesis, gosh, it's probably been at least 20 years ago now
Wow.
that her doctor told her that that wasn't something that was more well known, that was kind of
Mhm.
rare. You're never alone with this. There's always somebody out there to talk to about it. Um, and the people that I've come across in the support groups, they are more of a family than a community because they're I've seen people on there that will say that, you know, they've had enough, they can't endure this anymore and just need somebody to talk to. There's people that give their phone numbers,
Mhm.
or, you know, if you wanna, you know, talk over video chat or something, it doesn't matter what time of day or night it is, there's somebody there to talk to.
Yeah.
So
That's how I got in with
that's
G-PACT all those years ago. It started with the support groups, and now
Mhm,
here I am because I just didn't leave. Um, I just kept getting more involved, but
mhm,
it's very true. You know, those that supportive arm is so important and can sometimes it can make or break your experience for you. Really, you know, you can't just
yes.
rely on yourself or your partner or your family or your physician. Sometimes you just need people that get it with you. And I am so grateful that you reached out to share your story with us. And thank you for being so open and vulnerable, and really getting into the nitty gritty of your story. Because I know that there are going to be people that resonate with everything that you've talked about with us today. So thank you so much.
You're welcome. I'm glad to share my story because again, I don't want somebody out there to be alone in this
Hmm.
and just have to fight it alone because again, there's other people out there. And
Yeah.
again, our stories are not all the same, but I know one thing is we all suffer together. So
Yeah.
yes.
Yeah, it's good to have a friend in this space, or at least not feel so alone by listening to someone else's journey. So we're glad that you're here and that you're part of the different support groups and, you know, wanting to share your experience. So thank you.